Okay. I wanted to start off with Andrew's claim about regulating the prescription drug ads. I was a little confused on whether their decision was to either regulate it or ban it, but either way, according to our First Amendment rights, we do have, according to the First Amendment right, Congress shall make no law respecting an establishment of religion, prohibiting, I'll just skip to the freedom of speech, all right? With that being said, as long as they are not lying about in their advertisements, they can speak well about it. And according to pros and cons, Yuri Reinhardt, PhD professor of political economy, economics and public affairs at Princeton University, in an October 9, 2002 interview with Frontline, stated that the First Amendment. You made new products. Why can't you tell people about it? Why should that industry be forbidden to do it when the auto industry can advertise SUVs, right? A great example of this, like Brenda was saying, was actually nicotine patches. Nicotine patches have proven to be really successful, and they actually started off as prescription drugs. Now you can buy many of these nicotine patches over the counter to help people stop smoking. And Andrew also stated that the advertisements do not give enough information. According to FDA, all product claim ads, regardless of the media in which they appear, must include certain key components within the main part of the ad: the name of the drug, brand or generic, at least one FDA-approved use for the drug, and the most significant risk of the drug. Another one that they do have is either all the risks should be listed in the drug's prescribing information, or a variety of sources for viewers to find prescribing information for the drug. Honestly, you cannot just blame the ads themselves for the harms and risks that people don't know about. It is up to the person to actually go out and dig out information about this. You're not just going to go out and take a drug without knowing any information about it. You do have to do your own research. And he also stated that he believes that not enough trialing and experimenting with the drugs has been done. According to Livestrong, prescription drugs in the United States have passed rigorous clinical trials for safety and efficiency to obtain Food and Drug Administration approval. Most of these drugs are used to treat numerous conditions that range from mildly annoying to life-threatening, while some are taken to prevent diseases in high-risk individuals. I want to elaborate a little bit on the beginning part of this, from where it says conditions that range from mildly annoying to life-threatening. Not all drugs are actually used to cure life-threatening disease. Not all the drugs that are prescribed are used to treat life-threatening disease. A lot of these are used for very basic maybe sore throats or throat infections, antibiotics, things like that. And according to Livestrong, once again, not all drugs are used to treat serious illnesses. Some treat small ailments from time to time with great success. Antibiotics for infections, flu medication, and prescription cough are used only while the patient is sick. And we actually do have another group that makes sure that many of these laws are actually abided by, which is called the Center for Drug Evaluation and Research. And according to the FDA, part of the mission of I'm just going to say CDER, is to ensure that companies that sell prescription drugs also provide information that is truthful, balanced, and accurately described. CDER's Office of Prescription Drug Promotion oversees prescription drug ad activities. OPDT does this work by looking for and taking action against advertisements that violate the law, educating industry and others about the specifics of the law, and encouraging better communication of promotional information provided both to healthcare professionals and to the consumers. So it's not like companies can just actually go out and advertise the laws. There are consequences if these companies do give false information or do not provide enough information or any of this. And that will be it. Thank you.